without further ado, and I would like to invite now His Excellency President John Mahama, President of the Republic of Ghana, and actually a leading voice on Africa's sovereignty, having been the champion for the Accra Reset. A big hand for President Mahama. We truly appreciate your political and high-level leadership on the Accra Reset and the sovereignty agenda. Your Excellency, your 4 minutes starts now. It's very difficult to stop a president when they are speaking, because then you'll be going against a republic of people. So my request in advance is that we keep it to 4 minutes. Thank you, President Mahama.
Yes, thank you very much. I empathize with your problem with time, so I'm not going to speak for too long. I believe that everybody is familiar with the Accra Reset. We're motivated to come together to take our destiny into our own hands based on what the global realities were, that finance for health interventions and actually finance for humanitarian crisis response across the whole world was beginning to dwindle. And we needed to act in order that Africa could continue to meet its obligations under the SDGs. And so we met in Accra, we spoke, we defined what the problems were, and I don't think we need to go over them. 70% of pharmaceuticals in Africa are imported, 90% of vaccines are imported. We bear 25% of the global disease burden, and only 3% of pharmaceuticals are produced in Africa. And so we realized that we needed to take our destiny into our own hands. One, to increase our own finance and leverage more revenue, domestic revenue, to invest in healthcare and see healthcare as a strong economic pillar. And I think that discussion was had. But we need to look at the reality that Africa faces. One of the difficulties in leveraging domestic financing is the debt burden. It's linked to many things. One, if you are spending 50% of your revenue to service debt, how much is left for you to invest in education, in health, in agriculture, and all the things that create a decent life for your people? And so we said, enough of the talking, let's move into action. How do we create the vehicle so that, one, Africa can come together and come out with a compact that allows us to be able to improve health outcomes for our people? And so since Accra Reset, we've been taking some steps. We're looking forward to the World Health Summit so that we can all come together. I think Africa CDC, everybody is aligned. And so I think that the meeting we go to in the next week on the 18th will help us all bring our thoughts together. We should not be fragmented in the work that we're going to do. All of us need to pull together to be able to achieve the outcomes that we want. Funding is available, but we need to bring the private sector, the state parties, our partners, and all into the same boat. Accra Reset is not about isolationism. It is about how we can work better with our partners in order to achieve the outcomes that will be beneficial for our people. So I look forward to this discussion, and since I'm co-chairing, I probably would have another bite of the sherry at the end of it. And so I'll leave it here, and thank you very much for the opportunity.
Thank you very much.
Certainly this is a big creature, and we could have done more justice to it if we had more time, but unfortunately time is not our best friends. But let me just reiterate some of the things. IFC's AIM 2030 initiative, important. AFD's commitment to vaccine manufacturing in South Africa, UNITAID's technology transfer, Gavi's African Vaccine Manufacturing Accelerator, and several other things that we have reiterated. It said that ambition alone does not guarantee execution. We have another opportunity when we go to the WHO panel, and what we must do is to bring development finance partners, the private sector, and state actors all together to translate the pipeline discussions we've had into operational commitments. For us, the test in Accra Reset is whatever you do, does it build sovereign capacity or it deepens dependence? That is what we must all ask ourselves. And so thank you very much, everybody, for coming.
Thank you very much. Thank you to our co-chairs. Thank you to all the speakers. Thank you for your time, and let's keep Africa forward. Thank you.